Hi, everybody. This is Andrea Paquette, president and co-founder of the Stigma-Free Society. Welcome to our Rural Mental Wellness live event. We are so excited today to have Paul Adams with us. How are you doing today, Paul?
I'm really well, Andrea. How are you?
Great. So happy to have you here to learn more about you, the organizations that you're affiliated with and leading up. And yeah, I'm so happy. So thanks for being here today.
Thanks for having me.
Yeah. So for everybody watching, the Stigma-Free Society, as a start, is an organization, a registered charity located out of Vancouver, British Columbia. We really focus on the awareness of stigmas, education around them, understanding of mental health and stigma itself, and also the acceptance of ourselves and other people. And so we're really excited to have you join us here today live, or please do share after the stream. So I'm going to start with sharing a little bit about Paul. I'm going to share your bio, and then we'll just jump into some questions. That sound all right, Paul?
Sounds good. I'm going to apologize off the bat if we hear a lot of chickens and ducks and animals in the background. I am a farmer and I'm in the middle of my farm, so I do get a lot of unintended guests joining my conversations.
Well, on this type of stream, I think it's welcome guests, definitely, because we're talking about remote communities, farming communities, and that's part of it. So, no, I love that. That's really great. Okay, great. So, to start with, Paul is the new administrator of the BC Rural Health Network. In previous roles, he's been a medical office manager, executive director of the largest conservation group in British Columbia, and more recently spent over a decade working with forestry and government on environmental issues. Paul is a farmer, as he just mentioned, in Princeton, BC, and joins the BCRHN to assist in bringing better health outcomes to rural residents. All right, so this is a little bit of a bio, but I thought just for a little bit, if you could touch on more about yourself, perhaps anything you would like to share with our audience, and maybe some things I didn't cover.
Sure. So as mentioned, Paul Adams. I'm the new administrator for the BC Rural Health Network. I am a farmer, also as mentioned. My background is in senior management, but I come with a wide array of different skill sets from different job experiences over the years. From my personal side of things, I'm married. I'm a grandfather with two beautiful grandchildren. I have a large family, and I've lived rurally for the past 35 years, but I've been always had to work in larger centers, so I've commuted a lot from my place of residence into cities and worked in Vancouver and elsewhere, and have always had challenges in the fact of having to commute elsewhere to work. So a number of years ago, 4 years ago actually, I decided that I was going to head back home and work from home. And food security, organic food, those things have also been very important to me in my life. So started a small organic permaculture farm, and have been providing organic food to the local community since that time. This opportunity to work with the BC Rural Health Network happened over the summer, and I have taken advantage of the fact that I can now work in administration functions and management from my home base here in Princeton as well.
Yeah, definitely. I live in Souk, British Columbia, which is 45 minutes outside of Victoria. And I've been working remotely for 11 years, but really, truly, in a very 100% sense for the last year and a half for sure. And I got to say, Paul, like I really like working from home. Do you?
I do. Yeah. A little bit of the background noise can be a
Yeah.
little bit distracting in my case. So it's a combination of working from home, But with technology today, we can pretty much work from anywhere. And occasionally I'm interested in looking at potentials of working even more remotely, so that you can, now we have things like Starlink satellite to provide high speed internet no matter where you may be.
Yeah.
Which may be an advantage or a disadvantage depending on how you look at it.
Yeah, definitely.
But, but
Yeah.
I see the ability now to be able to work from anywhere to anywhere and network and communicate with
Yeah,
anyone.
it's wonderful. Yeah, I definitely agree. And so I want to jump into the mental health space now. And as you know, our Stigma-Free Society is very passionate about sharing personal stories, especially around mental health, but other stigmas as well. But I was really wondering if you could share your personal experience as a farmer and how mental health has impacted your world.
Sure. So I'm not sure that I have enough. I'm not maybe not long in tooth enough as a farmer to talk about everybody's experience, but certainly the isolation of rural life, and if you then add on to that farming, for example, and the work that your group has been doing with the rural health toolkit and providing access to information to farmers and rural residents generally is very helpful. But I think from a rural point of view, isolation can be burdensome on anybody, and especially if you have an underlying mental health or health condition. Those can be difficult challenges in a rural environment. If we look at farming in particular, it's a very isolated occupation as well. So there may be several people working on your farm, but it's quite likely that you're going to be working in isolation just due to the nature of the work that needs to be done. So we
Yeah.
build these very strong relationships within the farming community and within our farms. So you look at what's happened recently with the flood events in the Lower Mainland. And right here in my hometown, I live in Princeton, BC, and we suffered massive loss and destruction in these recent floods. And the impact to farmers is immense. Their connection to their animals, their livestock, and the ground which they've nurtured over years is a huge part of their lifestyle. And
Yeah.
losing that and losing those important connections become very challenging for rural farmers and for rural citizens generally.
Yes, no, definitely. And with the floods, it's quite devastating. And Stigma Free has been searching for a way if we can assist or support in any way, and perhaps even with the toolkit. So thank you for bringing that up. That is an imperative issue that's happening right now. And it's great that you can bring some insight to that. So I'd love to talk about the BC Rural Health Network. And I was wondering if you could talk about, its vision, its mission. What is this group? What are you accomplishing with this network?
Right. So the BC Rural Health Network started about 4 years ago, and was a collaborative of 6 organizations when it first initiated, and they were all local advocacy healthcare groups that came into place due to loss of services within their individual rural communities. So communities were losing emergency departments. They've had difficulty in recruiting physicians. There's been difficulty in recruiting staff for different specialties within health facilities. There's a whole myriad of issues which surfaced with changes to centralization of healthcare. So there has been a significant need for the rural voice to be heard at a provincial level. And there hasn't really been an organization that's worked, at least not effectively, in communicating and not only communicating to government, but from government to the rural residents. and from other NGOs to the rural resident, from groups like yourself, where we see our place and as being the facilitator of information flowing to communities and to individual rural residents, so that there's accuracy and information available, which otherwise it's just not reaching the ears of the rural resident. So that group started 4 years ago, and there was obviously a need for it because it grew exponentially, and there's over 70 club members, group members now, representing folks all over British Columbia, and that's been done on limited or no resources. So my background, coming in with some strong experience with working with local and regional and provincial governments, has opened up some new opportunities for the network in getting some security and funding, and improving our reach and outreach.
Yeah, no, thank you for that. And I was just curious about how you got involved. Like you mentioned, you recently taken this leadership role, and I was just wondering about your story behind that a little bit.
So it goes back many years, actually. So I was 20 plus years ago, and I was starting my own family, but my dad was a family physician in here in Princeton, and he served the community here for 30 years, and prior to that was in England, and was 20 years as a general practitioner over there. So he did 50 years as a rural physician, and about 20 some years ago he wanted to set up his own practice, and he was working in a group practice prior to that, and he asked if I would come in and set that up. And I did that, and in doing that I networked with the local community, with the existing health advocacy organizations as well as healthcare professionals, and I came in contact with Ed Staples and Nenka Clava, who were two of the original founders of the BC Rural Health Network. And again, just due to events in my personal life, so I say a farmer, but I had a farming accident this summer, and I broke my leg. Oh. And when that happened, it was kind of ironic that at the same time that my leg broke, and I didn't really know what I was going to do with my farming future, at least for 2021, an ad popped up looking for the new administrator for the BC Rural Health Network. And the names Ed Staples and Nenka Clava also appeared on that advertisement. So a lot of memories came back to me, and I recognized them as being strong community leaders. And I was interested in playing a part. And also at the same time, my daughter sent me the ad to say, you should apply for this. So I did, and here I am.
And you secured it. That is absolutely amazing. And yeah, I've been working with Paul for a bit now, and we've been talking about the future plans for the BC Rural Health Network. And I was wondering if you could share a little bit about that. What are the plans?
So we've been working on, the base of the network, and the purpose of the network is to be the voice of the rural resident on healthcare matters throughout British Columbia. And we believe that that voice is important to bring equity to health outcomes in rural BC. So we've been focusing in the last month over, what our vision is. How do we reach the people? What are the tools that we need in order to accomplish the goals? So I think there's always been a very strong purpose behind the BC Rural Network. And it came together so quickly and so rapidly that there wasn't really a lot of structure put into play. So my initial role has been developing some of that structure, making sure that we have the tools that we need to reach the residents, and to look at where our weaknesses lie. And from a vision point of view, we really see, and there's been a lot of work done recently. So whether it's been through the physicians of British Columbia, or through the Rural Health Center out of Kamloops in British Columbia, there's been studies done looking at how to effectively reach rural residents. And some of those approaches have primarily been to deal with different types of software and advances in technology and those areas where, anybody who lives in rural BC really knows that, communication and connection happens in person. It happens at the coffee shop. It happens on group pages on social media. And the problem with all of those methods of communication is there's a lot of misinformation that is passed on to rural residents. So we're looking at building a physical network of hubs, communication hubs throughout the province, looking at health supply areas and hope in the future having a regional hub in each health supply area, which is population-based, so that we can have teams and facilities in place which are going to reach similar levels of population throughout the province. But we really see from an IT point of view, there's huge potential to reach rural residents with IT, but you really have to have that community connection to bring that information, no matter what the format is, to the rural residents. So we want to expand that physical network of hubs and interconnectivity throughout all of our member groups, so that we're providing information, current, timely information that's accurate and science-based on a live basis, and also receiving information back from those member groups on a live basis that we can then communicate out to other groups, such as government.
Right. And I find like there's such a breakdown between the communities and the voice of the people when it comes to farmers with reaching the government. So I really appreciate what you're doing with creating those networks. And yeah, it's so needed. And I also wanted to talk to you today about the Rural Health Collaborative Education Foundation. And how is this different than the network, and what are the future plans for that?
I'm not sure that it's different than the network. It is a new society that was created, and it was created on the basis that, again, there was this collective that came together rather rapidly. And what they did was they copied the bylaws from their existing societies, and they modified those, and they made them into the new bylaws for the society, which was doing business as the BC Rural Health Network. And so there was some legal opinions provided, and those said that there'd likely be challenges in making charitable application with the society as it existed. Prior to my arrival, the group created a new foundation, the RHC Education Foundation, and that was created for the purpose of applying for charitable status and for allowing the BC Rural Health Network to operate as a charity under that foundation. So it's a little complicated, but basically the underlying reality is that the BC Rural Health Network will operate in the same fashion that it has in the past, but it would do so under the mandate of the RHC.
Nice. Okay. All right. So jumping off the organizational train and coming on to health and rural communities. So I was wondering, what kind of positive health outcomes do you strive to ensure for rural residents? What is the focus?
So the focus is ensuring that the rural resident is heard at the provincial level. So the president, Ed Staples, does sit on provincial tables and does provide input from the rural point of view within several provincial tables. So we have we do have a voice provincially, but it's ensuring that we're hearing what's going on the ground and reflecting that in the messaging that we're sending out, and then also ensuring that programs and information are received. So a prime example is the Rural Health Toolkit by Stigma-Free, is that it's an awesome tool and there's other awesome tools out there. And they just, unfortunately, it's very difficult to reach the right people with the right information. So again, our on the ground membership are provided with accurate scientific based information, and then they relay that out to their local communities. So without information, people either don't realize there's resources there to help them with their own mental health, or with their family members' mental health. They don't know where to get the information. They don't know where to seek the help. And the same is true with physical health and well-being. And we do a lot of focus on sickness and illness, and there is a need, I think, to do some transformation from the focus on sickness and illness into wellness and healthiness. So those are areas where we see the direct benefit to rural residents is simply providing accurate information and resources where they can obtain help and get assistance in whatever their health situation may need.
Yeah, and we are so excited to partner with you and get the Rural Mental Wellness Toolkit out there. And yeah, we definitely appreciate all the networks that you have to get information out to the people who need it most. So thanks for that. As well, when we're talking about physical health and farmers, and how does mental health in rural communities intersect with physical health? How does that work, in your opinion?
I give you my own personal direct example. This summer was, my entire livelihood and occupation, my reason for being woken at 5 a.m. in the morning and going to bed at 9 o'clock at night in the summertime is because of this passion about what you're doing on the ground and hands in the dirt, and working with animals and working with growing things. And all of a sudden, if you have a physical injury like I did, your entire existence becomes questioned. You're unsure how you're going to. My job is, as a farmer, is labor intensive. Everything we do, we're a very small farm. We just do everything by hand. So without the use of a leg, I attempted to farm on crutches, and working in soft fields with 2 sticks as your form of mobility doesn't work very well. So there's a lot of, if there is a physical ailment on a farm, whether that's due to injury or due to sickness, there's a huge impact to the farm itself. And from a mental standpoint, I've had depressive episodes over the course of my life, but that one hit me very hard, and very, very immediately was, what am I going to do, and how do I continue on? And I'm very, very fortunate and very lucky that the doors opened in front of me, and I was able to walk through them. But for many, that doesn't occur, and you'll see people lose their entire life's work just through one single event. Wow. And we've seen, again, in the interior of the province here, there's a lot of cattle ranching, and a lot of cowboys who are in the ranching business, who have worked not only as ranchers but also in rodeo circuits and those type of events, and had multiple head traumas, and we've seen some recent unfortunate suicides and deaths in communities around agriculture from those PTSD type traumas.
Yeah. And so, talking about stigma, I think this leads really well from your previous comment. When we're looking at the agricultural communities and mental health and stigma, how does that play out in your opinion, or does it?
It does, for sure. I mean, there's a machoism within the farming community, and I don't think it matters whether you what gender affiliation you are. There's some pretty tough people who are farmers, and they have broad shoulders and they take the world upon them. And I think that, any question of their wellness becomes a significant issue for them. They don't want to be perceived as being weak. There's a challenge for everybody, I think. But I think people who live in certain areas, who are isolated, who have certain occupations which have been given certain attributes that you are supposed to be this, that, or the other, have a hard time addressing simple aspects of their well-being and getting the appropriate help and the treatment for them. So stigma exists everywhere, and I think it exists for a lot of farmers in rural BC.
Yeah, I agree. And I was wondering, what can these people do to support themselves? Like, they're facing these challenges, stigma. I think there's always this you got to be tough kind of thing, like you're talking about. So what can people consider to help themselves with their mental health?
I think, again, the conversations that we're having today and that happening more. I mean, there's certainly a lot more awareness around mental health today than there was during, at any point in the past. But I go back to my early years and challenges that I faced as an individual, not related to rural existence, but just to mental wellness. There was not only were they unknown, but they were not discussed. It wasn't something that we had a conversation about. So I think just having the conversation is a big door opener. Yeah. I think organizations like yours with excellent programs and organizations like ours with outreach are incredibly valuable to people with any health issues. Just reaching people, giving them information, allowing them to assess themselves, and providing them with tools to take that assessment into care, care for themselves and self-care are incredibly important.
Yeah, and it's all about those first steps, right? And opening the door, like you were talking about, and having that conversation, which is so vital. And I feel igniting conversations free of stigma and being open, no matter how hard it can be, but accepting that, we all face challenges and we all need help sometimes, and it's okay. I think that's a good starting point, right?
It is, and working with communities, and I mean, we have some great folks on the ground. We have mental health outreach in a lot of small rural communities, but again, it's having people accept that is part of health. It isn't. We have, again, part of the stigma I feel is created through the separation of mental from physical health and just overall well-being, and to bring down some of those barriers and to have inclusiveness within the community. So we're working here in Princeton with the Vermilion Forks Métis Association, who are building a wellness center and a tranquility garden, and part of their program and their purpose is to house mental health outreach workers from the Lower Similkameen Society to do community outreach directly with individuals in the community, and to bring people who have mental health concerns and issues into the facility as a welcoming place and a place to treat people without stigma and on the same level. So those type of community-based programs and actions are incredibly important, I believe.
Yeah, no, incredibly important. And I was going to ask you actually about some of the resources people can find through the BC RHN. And I think that's definitely, linking in with the Stigma-Free Society. And as you say, the Métis Association. What are some other resources where people will get some information about?
Well, we're active in all areas of healthcare. One of the areas that we see as being a significant benefit in rural BC is the creation of community health centers. So a community health center is not just a place to go get treatment. It is an umbrella type of facility which houses all aspects of healthcare within the community and provides resources to people. It provides a place to be in emergency. It provides more of a holistic overview of medical needs for rural BC. And they don't exist in a lot of places, but there are certainly more coming into existence, and we're promoting the creation of more of these facilities. And that's being done at a community level, where you have to have buy-in from all of the community partners. So you have to have a physician's base that's interested in that approach. You have to have a health authority that's going to support it. You have to have the local community stakeholders wanting it, and you have to come together as a community to create it. And that in itself provides a community benefit. But it often also interconnects all of these different players within the community. So we bring in First Nations, you bring in the Métis, you bring in diverse rural populations of people. You make sure everybody's included and accepted within the model. And it's a great foundation for a more inclusive, holistic approach to medicine, I believe.
Oh, that's wonderful. Okay, well, we already went over half an hour because we were having so much fun, and that's totally okay. I always love talking to you. And one thing I'd like to close with, first, can you share the website of the network so people can find your organization?
So I will say that the website is extensive. It was all done on volunteer hours, and one of my main objectives is to have some injection of finances into that end, so that we can provide a better platform for presenting other people's programs and information as well as our own. But we are www.bcrhn.ca, and we will be making modifications to the site over the next period of time, and we will keep. There is so much information on the website as it exists. Unfortunately, it just doesn't have the sophistication needed to reach a lot of people and to provide a well-presented, comprehensive list of information. So we will be putting some resources into the redesign and of that site. But it is a wealth of information. If you're looking for information, you may have to go through a lot of pages of it, but you will definitely find a lot of helpful information on our site.
Amazing. Thank you for joining me, Paul. Stay on the call after. I'd like to thank you and say goodbye personally. And thank you to everybody who is watching today. And Paul, we really are looking forward to the future and to see more from your network. And thank you for everything that you do. And one last thing, as a farmer who, hurt himself, became, in despair, mental health challenged, is there any type of inspiring words or words of wisdom that you could share with someone who may be struggling as well?
Well, wisdom is something that I'm not sure that I have a great depth of, but I would say that there is always another side to a scenario. So when you face these dark moments in life, and we all do, that there's always points of light that we can focus on and that we can find happiness within. And for me, family, my wife, my grandchildren, my elderly parents, my siblings, all of that, and the animals that I work with, and the ones which are pets to me, all bring happiness to me, no matter what my circumstance. So having those anchors in my life, I'm incredibly grateful for. And I also recognize that not everybody has anchor points in their life that they can turn to in times of need. So for people who don't, I think there are community services, and there are people within your community, no matter where you live, that care, that care about more than just seeing somebody as a patient or as a 15-minute appointment. They actually care about you, and finding those people and finding those resources, if you don't have them already, I would encourage everybody to do that. And one of those resources is the Rural Health Toolkit from the Stigma-Free Society. And one of those people who care is Andrea Paquette. And so I'm not saying that everyone should reach out to you, Andrea, but you are the type of person that people need in their lives. So I thank you for that.
Aw, thank you. You're going to get me all teary-eyed. I'm so sensitive. Thank you so much, Paul. I really think highly of you as well. So thank you for coming today. All right, everybody. Please ensure to check out our Rural Mental Wellness Toolkit, ruralmentalwellness.com. Thank you, everybody. And Paul, have a lovely day. And everybody, please enjoy the rest of your week. Thank you.
Thank you, Andrea.